Hi, welcome to 8minutestohealth.com. Our amazing 4-week free program offered by Healing Journey. So if you haven't signed up for it already, please head over to 8minutestohealth.com and put in your email address. It's absolutely free. Make sure to spell out the number 8. So today we are talking about a topic that is near and dear to my heart, which is the link between health and mental health. And I am just inviting a colleague of mine, Lindsay Simmons, on camera, and she is also an MSW. And so today we're going to be talking about that link. So Lindsay, you are a bit crooked again. So if you can rotate the camera, I'm not sure what's going on. One more rotation. There you go, perfect. So I can see part of your head. There you go. Okay, so welcome, Lindsay. Let's see, can we hear you?
Can you hear me? I hope so.
Okay. So I was just telling our viewers today, actually I can see a bit of the ceiling, so you might want to tilt it down a little bit. I don't know why you can't see, but anyways, I was telling our viewers today that we were talking about the link between health and mental health, which I mean, both of us are trained as therapists. I'm also trained as a functional diagnostic nutrition practitioner offering lab testing, and thought it would be great to talk about that link between the two, and also just about the importance of therapy and how that can play a role in healing. So
yeah, absolutely.
yeah, and I think like the viewers know that I offer a functional health practice which looks at health from all perspectives. So I'm really big on offering lab testing for people, but I also think healing happens on all fronts, right? So, you know, you may have gut issues, you may have hormone imbalances, and I think those are big players of hidden stress. But you have to look at the body and the system as a whole. And part of doing that is looking at, you know, how are you thinking and how are your thoughts impacting what your body's doing? And so that's kind of what I do. And so this is a little piece of a bigger puzzle for me. So why don't you share with our viewers what you do?
So I'm a social worker and I provide CBT, cognitive behavioral therapy, for help with anxiety or depression, and also helping people to just achieve a kind of an overall mental wellness state. Sometimes people can't quite put their finger on it, but something just doesn't.
Something doesn't feel right. I think we've lost you.
Am I back?
Yeah, something doesn't feel right.
Yeah, so if something doesn't feel right, and they'll call up and we'll work together to help them just gain a better perspective of their own mental wellness as well as their own physical health as well.
And do you treat children, youth, and adults, or do you have a specialty?
I do. I work primarily with children and teens, and I also work with young women, helping to develop, self-esteem and understanding who they are and clear boundaries, healthy
Okay,
relationships.
okay. And I know like one of the big things for people when they think about therapy is actually getting into the door, right? So I think like based on when I was a kid, it was like, oh, you have to be really messed up to see a therapist. And I think things have really changed a lot, even from when I know you and I went to school together. So even from when we first started to study it to now, there's been a huge push in terms of, you know, everyone has mental health issues, right?
Yeah,
And so
yeah, absolutely.
go ahead.
Or we know that at some point in their life, approximately 70% of all Canadians will experience some kind of mental health issue, whether it's anxiety, whether it's depression, whether it's anger, whatever it is. Anxiety, you never really know what it's going to look like or when it's going to hit or how it's going to hit. But we know that approximately, like I said, 70% of Canadians are going to experience some kind of mental health issue throughout their lifetime. And I think one of the biggest challenges for people, like you said before, has been the stigma that's associated with mental health challenges, anxiety, depression, whatever it is that folks are struggling with. And like you said, it's becoming more in the forefront of conversations. We have things now like Bell Let's Talk
Yeah.
Day, where we take things like mental health and we bring it to the forefront of the conversations. And they're, really brave people who are out there sharing their stories and helping to normalize the struggle with mental health.
Yeah, and I think that's made a big deal in terms of everyone is dealing with it and normalizing it. And I think that's
Mhm.
helped. I think there's still sometimes that struggle, okay, so I've acknowledged I have mental health issues and I've acknowledged maybe I need help, but I think sometimes knowing that you need help and then being able to call and ask for help are two different things. Because I think making that call, there's a bit of an acknowledgement of, I can't do this on my own. And to acknowledge that, like I need someone else to talk to, I think can be really difficult for people because I think there's, a lot of shame associated with that idea of like there's something wrong with me, that I can't figure this out
Mhm.
myself, or that, I can't talk myself through it, or that, my support system in my life can't help me through it. And so how do you recommend that people kind of move past that?
Working through that shame, like you mentioned, and coming to a place where you can acknowledge, okay, I need some help, I need some support in this place. If you think about it, if you got the flu or you got something, you would have no problem going to your doctor and saying, okay, I need some help with this. Getting your mental health to a place where you can kind of work through that shame and work through that stigma. It's a different process for everybody. It's a bit of a different journey, but even just going online, I always tell people to advocate for themselves, even if you just go online and kind of look around in your area and see who's talking about what and what are some of the conversations that you're seeing. And the more that you start to kind of expose yourself to that and see that you're not alone and you're not the only one who's struggling with some of these issues, the easier it becomes to pick up the phone and make the call or send the email to reach out and get some support for whatever it is that you need.
Yeah, and I think, as human beings, we can bring ourselves so far. And then I think sometimes
Mhm.
we need support. Like we were only built to kind of bring us this far. And then we need support from other people to bring us that far, right? Like we need professional support. It's like anything else in our lives. Like, we're not gonna start drilling holes into something if we don't know how to use a drill. And in the
Yeah.
same way, I mean, the talk of emotional intelligence is just starting to come up, but it's not something that's taught in school. We learn how to memorize information. We
Yeah.
learn lots of other, group dynamics. But I think we're starting to see mental health being more taught in school, and we're developing an emotional intelligence from a younger age. But that's not
Mhm.
necessarily at the forefront. And I think sometimes going to a therapist can also help develop those skills that had no other way to be developed in life. What would you say about that?
Yeah, absolutely. Certainly, like you said, there's no skills. We have.
I think you Oh, I think we've lost her. um, so I'm just gonna keep going for a little bit longer in the hopes that she somehow comes back to it. But I think in oh, there she is. I think in terms of um, the mental health piece, it can be important to talk to somebody else to get that support. I think therapy um, can be really, really helpful for people and a really great place to learn some tools on how to do things. It can also be a place for you to talk about things in a space that maybe isn't safe with anyone else in your life. So, Lindsay, I'm just talking about the space that's offered in therapy. And when I was a therapist, oftentimes clients would come to me and they didn't even necessarily have a specific goal in mind, but it was just like, I just want the space to process. I need to talk it out, and I need somebody to listen who doesn't have a bias and can reflect back to me what's going on with me. And I found that that was
Mhm.
often the most powerful part for people of the therapy experience, was just coming into the room and being able to share those feelings in a non-judgmental way and knowing that they could leave that in the room. So like, I'm not going to be in their life being like, hey, I know all your secrets.
Yeah. Yeah, absolutely. It's so important for people to take that time, and I think we get so busy, our lives are so busy, that it becomes challenging to take that time and kind of carve out 1 hour a week for yourself or 1 hour every other week and just go to a place where you can get in touch with who you are in a safe space where no one's going to judge you. No one's going to try and turn that around. It's not the same as talking to your friends. It's not the same as talking to your partner, because those people have a connection to you. Whereas you go to a therapist and it's a neutral third party who, like you said, doesn't know all of your secrets when you walk out the door and isn't going to share anything. And it's that safe space, that non-judgmental space where you can go and talk about the things that are bothering you without worrying about the impact that it's going to have on the other person in the room.
Yeah. And I also found like something I did a lot as a therapist was just reflect. So in a way, I was kind of holding up a bit of a mirror and saying like, hey, this is what I'm seeing you're doing. Are you noticing you're doing this? And so it provides
Mhm.
a bit of again, I'm all about the space, but that space for you to kind of see or explore parts of yourself that maybe you wouldn't necessarily be able to do otherwise because somebody's judging you for doing that. So it's not safe to think about, like, am I doing that? And then
Yeah.
also, it's not necessarily always somebody giving you advice either. I think there's this misconception that, you're going to a therapist and the therapist is going to be like, hey, well, you should be doing this, or like, you should think this way. And it's not necessarily about that.
Yeah. Yeah, no, absolutely. I like the image of using a mirror and helping people to see what it is that they may not feel comfortable enough to see with other people, because you are worried. As human beings, we are worried about how our words are going to impact people, especially those close to us. Whereas when you have that conversation in a safe space with a trained therapist, they're not always going to jump in with advice. Like you said, they're not always going to tell you right away how to solve your problems. They're more going to help you be that mirror, like you said, and help you just reflect and help you see what other people might be seeing as well.
Yeah. And that's not to say that as therapists, we don't have tools in the toolbox. I think, one of the things that you and I both offer is cognitive behavior therapy, which is a pretty concrete. I mean, we've kind of gone from let's just talk about whatever's coming up to you to concrete tools. But CBT is a pretty concrete idea,
Yeah.
different ways to think, right?
Mhm. Yeah, it's well researched, it's empirically based. It comes with a lot of different tools that you can use to help people with whatever it is, the anxiety, the depression. There's a lot of different pillars and different facets that we look at when we're doing CBT or cognitive behavioral therapy. But like you said, it's well researched and it's well known to be very helpful and a very valuable tool to have in your therapist toolkit.
Yeah. And so there are some definite concrete things. I know in terms of the mind body connection, there's a pretty big link between what we're thinking and how our body is feeling, right? And how would you say you found that link in therapy? Like, how do you work with it?
So one of the things that we try to work with in CBT is teaching calm thoughts and calm body. In CBT and cognitive behavioral therapy, we're working at helping people to have, like I said, calm thoughts and calm bodies. And so there's a lot of different ways that we can do that. And those two tools really help people to cope with whatever their stressful situation is, whether it's anxiety or depression or work stress, whatever it is. Once we can learn those tools of calm thoughts and calm body, then we can put those together and build up coping skills and self-esteem as people go through their various challenges in life.
Right, because I think what happens often is that we get thinking a certain thing, and then that activates feelings. It's gonna activate that physiological response, right? And so if we're always thinking negatively, we're going to be releasing these chemicals associated with negativity, and then that's going to be impacting our body as a whole. And I think sometimes it's hard,
Yeah.
obviously, to measure the tiny, tiny impacts associated with that. But there's definitely that connection between what's going on in the mind and what happens in the body, and they've actually seen the reverse. So there's a model out called the cytokine model of depression, which talks about how depression can also be a result of inflammation in the body. So that's the body's way of telling us you know, that something's not right, we need to slow down and figure out what's causing the inflammation, right? So it can work both ways. It can be thoughts kind of coming in and impacting our body, and it also can be our body giving messages through our thoughts, right?
Yeah, absolutely. Good physical health supports good mental health, and good mental health supports good physical health. And we see that all the time in the CBT model, where we'll get kind of a situation, something will happen in life, and you'll have a thought. And whether that thought is a positive thought or a negative thought will create an emotional reaction, and then, of course, a behavior. So if you have a negative thought, your emotional reaction may be fear or sadness. And then, of course, you'll have an emotion or a behavioral response based on the thoughts that you had. So working within the confines of CBT, we're trying to help create some of those calm thoughts and then help you create a calm body as well.
Yeah. And I know we use, I know I used it a lot in my practice as well, is meditation and mindfulness as well, right?
Mhm.
And
Yep.
what we're seeing with that is that the mind, like the calm thoughts and the mindfulness is going to be activating the parasympathetic system. So when you're anxious, when you're stressed, you're activating the fight and flight system. So that's not a really big healing space, right? If you're thinking
Mhm.
about, like, think about run from a bear, if you're thinking about running from a bear, your body's not going to be like, oh,
Yeah.
let me just repair this lining of my gut wall because, like, I have all the time in the world right now. And so even though there's
Yeah.
no bear, the minute that our body senses that stress, it goes into that panic state. And so the mindfulness is a really big part of activating the parasympathetic state, which then puts you into a space for healing, right?
Absolutely. It puts you into that healing mind frame. And there's lots of different ways that you can get into that healing mind frame through guided meditation, through guided imagery. Even breathing exercises can go a long way for calming down the body and helping you get into that healing mind frame. Progressive muscle relaxations. There's lots of different tools and different ways that we can create that calmness and that stillness within the body that allows the mind to go into a calmer place, and vice versa as well. If we can create calmness within the mind, we can create calmness within the body, and we can use that as a healing space for both mind and body.
Yeah, so it's really, really connected, right?
Yeah, absolutely. We know that people with chronic disease are 3 times more likely to experience mental health issues than the general population. And it's just when you think about, the people with chronic disease have sometimes social isolation, they have changes to work. There's all kinds of changes that take place in that world. And when you compare that to the general population, these folks are, like I said, 3 times more likely to experience mental health issues during their time.
Yeah, so there's like the social aspect of having a disease and the disconnect, and then there's also the physiological aspect, right? If your body is inflamed, if you're somehow activating, like the hidden stress is activating the sympathetic system, then it's going to lead you to mental health. So it's a very complex picture when we really talk about the link, and I don't think we actually know just how connected it really is. I think intuitively we know, but I think science is just kind of starting to prove what maybe we kind of already know, is that there's that deep connection. And I know
Yeah.
we were talking a little bit earlier before this call about the importance of lifestyle factors in mental health as well, right? And how eating healthy and sleeping well and that kind of thing also really impacts mental health as well, right?
Health. Absolutely. One of the first things that I always tell people when I start seeing them is the 3 main pillars for good mental health are getting enough sleep, eating healthy foods, and getting enough exercise. Because, like we talked about before, when you have good physical health, you're in a good place to access good mental health. And when you're experiencing good mental health, same as before, you're able to access good physical health. We used to think that they were in kind of 2 separate silos almost, and there wasn't a lot of overlap. But now, of course, we know that's not the case. We know there are biological factors relating to mental health as well. But like you said, we're just starting to scratch the surface
Yeah.
of how deep connected the two really are.
Yeah, and I mean, I had a client. She was a therapy client at the time, but also was seeking functional medicine support and found that there was a definite gluten issue, and then later actually learned that that issue was quite significant. And when she eliminated gluten from her diet, actually found a decrease in anxiety. And so there were reports by other people around her that they saw a significant decrease in how she was expressing her anxiety. And so right there, I think is like a huge connection that is shown. And I mean, I could go on and on. That's a whole other
Yeah.
Facebook Live about gluten. Stay tuned for a later one about that connection, right? But that's just one of the many examples about how lifestyle can really play into the physical manifestation of anxiety.
Yeah, I mean, if you even think about the difference in your ability to cope on a day where you had breakfast, had a healthy breakfast, versus a day where you
Mm.
didn't even eat anything for breakfast at all. And you take those two scenarios and you walk into work and there's bad news waiting for you. You know, if you haven't had any breakfast, you're less able to cope with that bad news than if you've had a healthy breakfast and you walk into the office. You're in a better place. Your coping skills are stronger when you've eaten something as simple as eating a healthy breakfast in the morning. You know, and I think when we look at those really basic examples, we can see the link between our physical health and our mental health is undeniable. And we just need to make sure that everyone understands how the two work in tandem.
Yeah. Yeah. And I think that's such a great example that so many people can relate to, right? Is the breakfast. I'm sure
Yep.
everyone watching has probably skipped breakfast every now and then. And I mean, even the hangries are the hungry grumpies are another great
Yeah.
example, right? Of like wanting to murder somebody before eating a meal, and then you eat a meal and you're like, oh, I love you.
Right?
Like really
Exactly.
or like the example I like to also give is like eat a piece of chocolate and like watch how your body's like, well, if you like chocolate like me, your body's like, oh, you know, like, oh, I'm eating chocolate. And
Yeah.
like that's just like one tiny thing that we're putting in during the day. And that's already released a bunch of chemicals in my brain that is making me happy.
Yeah. Exactly. And it's the same thing if you get enough sleep, if you're tired and you go into a stressful situation versus if you've had a good night's rest and you go into a stressful situation. The link is undeniable. Like I said, we just need to make sure that we are doing a service and we're working on our physical health and our mental health at the same time, and that we're really appreciating and understanding the overlap between the two systems.
Yeah, and I think just going a bit deeper on that, I know we've talked about some pretty basic ideas, but if there's unresolved trauma or anything like that in the past, I think that can be a really big factor for people that can really slow down healing. I know for myself, I've had to really let go of some stuff that I've held on to on the past and make sure that I've dealt with some of that stuff. As that, I think, you know, it adds an extra weight, right? So when we look at healing, we're looking at you know how many weights are you carrying and addressing mental health is kind of or a past trauma even one is just kind of making our body lighter and it's clearing the pathway to healing, right? So I guess you can look at past traumas as kind of roadblocks to healing if you want to have that imagery involved. And so
Yeah.
I mean, you obviously don't have to deal with past trauma, but that's going to be one of the big things that's going to impact moving forward.
Yeah. Yeah, absolutely. You know, I often use the imagery of the luggage and the
Mm,
suitcase and how many bags are you bringing? How much luggage do you have? And what are some of the bags? What is some of the luggage that you would be willing to let go of or willing to at least focus on and open up and kind of sort through what's in that bag and see what can go and what can stay to, like you said, lighten your mental load, lighten your emotional load, and open up that space for you to have mental and physical healing take place.
yeah, yeah, and that's why I think right now I offer primarily looking at things from, you know, a testing perspective and a holistic perspective, but eventually I'm also going to be including a component that looks at, you know, addressing a little bit of the mental health piece through some therapy as part of my program as well, because I think, you know, it is a big picture.
Absolutely. Yeah, it's that whole looking at it holistically. It, instead of looking at your body and your mind as two separate components of who you are, taking them and putting them together. And how do those two systems work in tandem? And if we can understand the physiological causes, then we can start looking at some of the mental health implications and vice versa as well, instead of just trying to put everything into different silos,
Ex-
understanding how everything in our body works together.
Exactly, exactly. The interconnection between it all. Lindsay, do you offer like Skype sessions or are you mostly in office?
I have both. I work in office and I also work online. I do online sessions as well for folks living in the province of Ontario.
Okay, so if someone in Ontario wanted to connect with you, we'll just put your link at the in the comment section, um, and they can connect with you that way.
Absolutely.
Okay. Well, thank you so much for your time today and for talking with me about mental health, your experience as a therapist, and the connection between them both.
Thank you so much for having me. This was great.
Okay, I'm sure you'll be back again soon.
I hope so. Take
Okay,
care.
bye-bye.